I would now like to introduce the topic canine myasthenia gravis. This is kind of common in some of the breeds of our dogs, and it involves the neuromuscular junction, so it kind of fits nicely into the neural section. Well, myasthenia gravis can be found in dogs, cats, and humans. Those are three very common animals. Humans are animals, I guess. For us, dogs and cats are interesting, and I want to focus on the canine. Well, myasthenia gravis, in a lot of the cases, not all the cases, but in a lot of the cases, is where the immune system produces antibodies against acetylcholine receptors. Now, if you remember the neuromuscular junction, the receptors are on the postsynaptic membrane. They bind acetylcholine, and then acetylcholine is chewed up and removed. Well, if you have antibodies attaching to the receptors, that would first of all interfere with acetylcholine binding, but it also, in most cases, or a lot of cases I should say, the receptors become unusable and they need to be regenerated. Well, the bottom line then of this is you have muscle weakness. Could be the whole body, every muscle in the body is weak, or it could be more focused. And in dogs, a lot of times it is focused, and it focuses on the esophagus. So then we have to introduce this term megaesophagus. Sometimes you'll see it as two words, but a lot of times you'll see it spelled together. Mega is a prefix meaning large, and esophagus, of course, is the tube that carries food from the mouth region to the stomach. And it's very muscular. A lot of it is skeletal muscle. There's some smooth muscle. But it uses peristalsis to transport the food from the mouth to the stomach. And in the dog, of course, most dogs eat standing up on their four legs. Well, then the esophagus is rather horizontal. And I'll show you a few radiographs of that. So, long story short, you have a flaccid, enlarged esophagus that doesn't transport food like it should. So let's look at a model where the antibodies are binding to the acetylcholine receptors. And of course, I'm not an artist, so I have to borrow these things. Okay, so here on the left is the normal, and I'll review it for you. Remember, this is a neuron. This is the axon, actually, the nerve impulse traveling along the membrane. It's probably going to be myelated. They're not showing that. Anyway, we get acetylcholine released into the cleft. ACH is the abbreviation for acetylcholine. It binds to the receptors. It causes this muscle to contract, and that's normal. The right side is in the case of myasthenia gravis. All the components are the same: the neuron, the muscle cell, the acetylcholine gets released, but now it can't bind to the receptor because of these antibodies. And the antibodies are in blue here, and they tend to have a Y shape. And so let me draw that up here. Most antibodies can be drawn like this. You can see they've got that drawn, and they look a little different, but basically the Y shape. So the antibody is made against the receptor, and that's abnormal. I'm going to talk about that. It's an autoimmune disease. We already said that. And it prevents the muscle from contracting. So you get little or no muscle contraction, and that yields muscle weakness. Now I'd like to convince you that the esophagus should always be closed unless there is swallowing going on. And here is a transverse section of the neck of a horse. Remember, we've warned you before about kind of graphic images, but I'll orientate you here with my little laser pointer. This is the part of the neck that's forward. So if you come up to the horse, walk up to it, this would be looking at you, the side looking at you, okay? Up here, this would be on top of the neck. Okay, this region up here. And here we've got the vertebral C6, the vertebra, I should say, C6. C is the cervical, the sixth one counting from the head. When you leave the head, the first vertebra in the neck is C1. Excuse me. And you go on C2, 3, 4, 5, 6. And I know in all mammals, except maybe I think there's one mammal that has not this formula, but they always have 7 cervical vertebrae in the neck. The giraffe has 7, humans have 7, dogs, horses, cats have 7. So we're kind of far away from the skull, and I want to point out the trachea. The trachea is open. It's always open. It's cartilaginous rings that stay open, and of course air is going to be inspired and then exhaled as well. But then look at the esophagus. It's rather small. And this is in the neck of a horse. So the point is, there's probably always a small lumen when the horse isn't swallowing. And of course, this is a dissection specimen, but you can see how small the lumen is in the esophagus, and you can't imagine that swallowing any hay or whatever the horse may eat. But it does because it enlarges and transports food down from the mouth to the stomach. So that brings up the point, peristalsis. So let's look at this. This is a diagram showing the same esophagus but at 3 different times. The far left one is there's a bolus of food that's being swallowed. And notice how the esophagus is constricted maybe I should say, behind the food, and in front of it is not, and so it's going to propel the food bolus down here towards the stomach. So we have like time 1, time 2, time 3, but we end up getting down to the stomach, and if you can see, after the food has passed, the esophagus basically is closed, like I just showed you in the neck of the horse. That's peristalsis, coordinated muscle movements that propel material in one direction. Well, maybe what I should do then is, this could be a human in the upright position, but you know, dogs would be like this. And so if that esophagus isn't working properly, you're not really going to get transport very well from the mouth to the stomach. And it's kind of interesting, some of the workarounds that people have come up with animals that have megaesophagus. But I'm going to show you some of the radiographs now. So let's just look at this briefly. These are dogs. And I just want to point out, here's a radiograph. And if you can't tell, over here on the left is cranial. This is caudal. This happens to be the heart. Okay. And I want to point out the trachea first. The green arrows are doing the esophagus. Here's the trachea. Look at, I'm in the lumen. It's rather kind of uniform all the way along. It's always going to be open in all the radiographs. It really can't close. But then here is the outline of the esophagus, way too big. It should be tightly closed, but it is way too big, and that's like a diagnosis for megaesophagus. Now let me get that one out of the way and do another radiograph that's got some labels here, and it actually shows food stuck in the esophagus. I'm going to enlarge this so I can point out some things. Okay, well, to orientate you, here is cranial, and here is caudal. And I just want to show you the trachea again. You can see the cartilaginous ring structure. It's open. It's going to be open all the way to the lungs, and then of course the trachea splits off into the 2 bronchi. But here we have food that's actually stuck in the esophagus. It can't propel the food down to the stomach, or should I say across to the stomach, because the stomach is way over here, right? This is caudal. And then here's some food on its way to the stomach. And maybe it's going to make it, maybe not. Now, one thing I should say is sometimes in dogs with megaesophagus, it has a spontaneous remission. Sometime down the road, it might get better, and that's sometimes the case. Of course, you can read up on megaesophagus and myasthenia gravis all day long, but I'm just doing a summary. But I think it's kind of neat what people have done. Here, you can feed a dog, and that black dog is really just drawn in there. But here, if you feed a dog like this, then the esophagus is not horizontal. It's more vertical. It's not perfect, but that's a large angle, and you can take advantage of gravity to get the food as it's being swallowed down to the stomach. So that's kind of ingenious. That's what some people use. And then here's a real dog eating this way, and it doesn't have quite as fancy a setup. This is more a spontaneous setup where they've put one of those tubs up there, and this Great Dane is eating food. But you can see the point is we're not going horizontal with the esophagus. It's going to be more vertical. It's not perfect. Okay. And finally, there's a thing called the Bailey chair, where the dog is actually sitting up on its rear end, and it's pretty much vertical. So I wanted to show you that because it's just amazing what people have done. I'll enlarge this here to show you what a Bailey chair looks like without a dog in it. It's some apparatus, usually padded, where the dog will sit in this device. This tray can be moved or put in after the dog gets in there, and then the front legs of the dog rest on this tray, and then it eats. Okay, so let's look at some of those other pictures. You can see a couple German Shepherds here, and they're different. There's all kinds of different kinds of Bailey chairs, and you can look at those and pause the button if you want. I'll try to give you a better view here. There's those things there, Bailey chairs. This is actually almost could be called a Bailey swing, couldn't it? That's my story, and I'm sticking to it.